So we're using biological indicator or biological control to check the efficacy of sterilization process. But what if this control fails? Or what if this control is positive? Well, now what should I do? What are the steps that I should take next? First of all, sterilizer out of service. Notify your supervisor and infection control department. Now, objects other than implants, you no need to recall them because of a single positive spore test, unless your procedure is defective itself. So first of all, thing that you should do, you should repeat this biological indicator test in 3 consecutive cycles. If any of them is positive, then you have to consider all the items are non-sterile and not acceptable, so they should be recalled. They should not be used, and they should be reprocessed with effective sterilizer. Now you have to check to ensure that sterilizer was used correctly, because most of the times the process is not followed properly. If that is not the case, or if that is the case that sterilization process was defective, we have to repeat the process using the appropriate settings, and all the SOPs need to be followed. If that does not solve problem, then you have to check with electrical regularities, you have to check the steam supply, and any abnormality should be corrected. Also check the biological indicator, because whether correct biological indicator was used or not. If not, then repeat using the appropriate one. If all of the above steps they does not resolve the problem, or you have run the 3-time test again and all 3 are negative, then you can put the sterilizer back in service. That means above steps have resolved your problem, or you have rerun the control 3 times consecutively and all 3 are negative, then you are safe to use the sterilizer again. But if that is not the case, then you have to ask your maintenance personnel to look the equipment. You have to ask your maintenance guy to check the steam supply line. You have to also contact the autoclave manufacturer, and you have to also repeat the biological indicator using some another manufacturer's indicator. If that does not solve a problem, you have to shut down that sterilizer until the manufacturer can assure that it is operating properly. Once he assures you, you have to retest again with biological indicator for 3 consecutive sterilizer cycles.